Well, thank you very much introducing me. And thank you very much, Professor Jorgensen and Professor Baldwin, to join this webinar. Uh, I'm the chairperson of this RIETI, and I would like to start my presentation. And my presentation is titled Social and Natural Factors in the Pandemic. And as Mr. Watanabe pointed out at the beginning, I think we are really at the turning point in the world right now due to the COVID-19. We are in a really uncertainty. We are living a rather uncertain world. And we thought the society was interconnected, as Mr. Watanabe pointed out. And we thought the globalization was a rather good thing and going well. And somehow, last 4 years or so, those things are kind of disintegrating and fragmented. And on top of that, this COVID-19 is accelerating this type of tendency. And I think we are in a very, very important point. And with respect to these kind of problems, I think the political factor is really important. And I started out my research checking out the political factors of accelerating the pandemic. And I would like to start out with this that presentation. And I think about the COVID-19 pandemic at the very, very beginning stage, I think both natural and social factors are at risk. And the importance of social factors were, I think, underappreciated. And I still is underappreciated, I think. And that's what I would like to address today. If you look at this diagram, this is a kind of natural factor, the very, very famous, well-known epidemiologic development of the pandemic. It accelerates at the very beginning, and from the middle, we may be around this area, but from there on, it will hopefully start decelerating and establish herd immunity. That's the natural factor people have been known. This diagram has been known like since early 20th century. And in addition to this natural factor, I think misinformation from political leaders are very, very important. And I don't go over this point because it's so well known. But in addition to that, I think at the very beginning, we had a rather unfortunate misinformation from the medical profession, maybe because masks were in short and so on. But like, for example, the Dr. Anthony Fauci, who is very famous medical regulators, and he was the person who successfully fought with the AIDS pandemic in about 20, 30 years ago, and told in March 19, for example, told there's no reason for anyone to wear a mask. And this kind of had a really unfortunate effect for a long time, I think. And this kind of misinformation is, I feel, it's a bad starting for this pandemic. I think early misinformation have had a really long-lasting negative impact, and still we are suffering from it. And this is perhaps because the influence of political leaders are very, very large. And it, I think, has disrupted self-protection effort. Everybody don't want to get sick. So lots of people naturally put a lot of effort in self-protecting themselves. But I think that's slowed down by the influence of misinformation, like I talked about. And I want you to see the evidence for this, my intuition. And that's what I studied a little bit recently. So I would like to share that, my result of my study. My research on the early stage of pandemic my findings are that people did learn and make self-protective efforts against the pandemic. That's the first thing. And the natural factor and the influence of political leaders are, however, so severe that private self-protection efforts could be wiped out in some cases. And that has been the problem, I believe. And to establish this by evidence, I looked at the very early Florida outbreak. I picked up Florida because of the following reason. Florida had a relatively large cases early on from the very beginning. And another reason is Florida is a unique, in the United States, I think Florida is a very, very unique place, which is surrounded by the sea. And another thing is that Florida was a relatively easy state to capture political effect, namely I call core Trump supporters. We can capture that relatively easily by looking at Florida. So I started studying Florida. And first of all, there are many, many potential factors. There are lots of them: population, number of cities, per capita income, educational levels, housing prices, wage rate, area, numbers of hospitals, and poverty, and so on. All those things appear to be contributed to the pandemics early pandemic in Florida. But further study showed that actually the population was a really dominant factor. And if you put the population and other factors in together, population wins. And that's other things that were kind of wiped out. And the result was the larger the population, the more per capita cases. And that shows kind of acceleration effect of population because it's a per capita estimated against the number of populations. So that means that the number of cases has a second order effect of population. And the second order effect is positive. That means graph looks like that and the acceleration effect exists. And that kind of captures the natural pandemic effect. Besides that, I looked at the political factors, which I thought is very, very important. And so I looked at the size of core Trump supporters as the dominant supporters. And I found that core Trump supporters were very, very strong positive influence on the cases in the Florida. The larger the size of the Trump supporters, the more per capita cases. That's my result. And in addition to that, the size of core Trump supporters had actually bringing out the population densities actually have a negative effect on the per capita cases. That's rather strange because intuitively speaking, if population are more dense, it's more likely to have more cases. But my estimation result said the opposite. And I was wondering why that's the case. And it took me a while to think about the reason. And one of the reasons why I came up with is that maybe because people live in a more crowded area realizes that they are more likely to catch the virus, and because of that, they may have made more self-protection effort. And I wanted to see that effect. So I decided to look at the urban population effect and self-protection efforts. If you remember, in like March and April, the main areas where the people got sick are urban areas: New York, New Jersey, Connecticut, and so on and so forth. So maybe I thought the more urbanization, the fewer per capita cases, because people like in Florida learned this influence of the population going on, the cities going on in the New York and New Jersey and Connecticut. So I looked at the number of cities, the effect of number of cities, and we checked this cross effect between the population and the number of cities. This is K is the number of cities, P is the population. And I found that in counties with, in Florida, I'm talking about, in the counties with population more than 800,000, the more urbanization, the more per capita disease cases existed. And actually, 800,000 population is there are only 6 states in Florida, only 6 counties, sorry, have a population larger than 800,000. So the very small counties, in those small number of counties with a large population, the population increased the cases. On the other hand, the smaller the counties with a smaller number of population, the per capita cases decreased when you have more cities. And that kind of shows that people probably learned that the larger the more concentrated people are, they tend to get sick. And therefore, they should be careful if you are living in a populated area. And that seems to have contributed to reduce the cases, per capita cases in Florida. So in summary, what I found is, I repeat that while the social learning effect was strong enough to reduce the per capita cases in the areas with a small population, it was more than eliminated by political and natural factors in the large cities, like Miami. The Miami-Dade County has a large population, and those areas, the political and natural factors are stronger. That population increases, cases gets worse. That's what I found. And in comparison with the Japanese cases, as you know, in Japan, the spread is not as bad as in the US or in the Europe. And my finding in Florida kind of suggests that the reason why we have so fewer cases than the US and the Europe is maybe because early warning given by the government helped a lot. Actually, the Prime Minister's office stopped the school in very beginning of March. In February, I think 28th or 27th, they announced the school will be closed. I mean, the grade school and through the high school, they closed the school at very early days. And that probably set the kind of tone of the Japanese society to be more careful about it. And another possible thing is we are accustomed to use masks. And mainly because really we have a very bad cedar pollen allergy in the spring. And everybody, lots of people are prepared to go against in the January through February through March. People are against and prepare masks in their household to go against this cedar pollen allergy. And that may have contributed to suppress the spread at the very beginning. And this is the kind of thing which I cannot prove it yet, but I would love to prove this kind of scenario, which is kind of consistent with what we found in the Florida outbreak. And that's my presentation. Thank you very much.